Good morning. This is the Anchorage Emergency Operations Center operational update for June 30th, 2021. All right, still sporting sleeves up for summer and going on to situation overview. Go ahead.
Good morning. Today is day 483 of our response. As currently reported, locally, we're up 105 cases since the last report a week ago, up 1 death and 1 hospitalization. Statewide, up 188 cases, 1 death and 4 hospitalizations. Next slide, please. For 213 resource requests, we filled or otherwise satisfied 1,770. That's an additional 2 since the last report, with 30 currently working. Next. At the Sullivan, we've got 310 clients. That's up 11. In the non-congregate sites, 357 clients, down 6. At 667 clients in all shelters, up 5, averaging 2,001 meals served per day. Next slide. In the last 7 days, at the visit testing sites, there were 1,390 sample collections performed, and in the last week at all pods, there's 683 doses administered, with 79,683 to date. End report.
All right, thank you, situation. Up next, weather. Go ahead.
Good morning. We have mostly sunny and dry today and tomorrow with temperatures in the 70s, increasing cloud cover and a chance of rain throughout the weekend, and some gusty southeasterly winds along Turnagain Arm and the higher elevations Thursday through Saturday.
All right, thank you, weather. Testing vaccination, please go ahead.
Good morning, everybody. This is Pat Ryder, Emerging Infectious Diseases Assistant Program Manager. Today with testing, Visit Healthcare had an increase of 8.99% over the previous 7-day sample collections. We are seeing an increase in community cases. As of June 29th, our estimated daily growth rate is 2.01%. Our 14-day averaged reproductive rate is 1.051, and our 14-day average case rate is 5.04 for every 100,000 residents. Our current alert level has been risen to intermediate. With vaccines, Visit Healthcare clinics had a decrease in average daily vaccination of 20% from last week. And we have some upcoming pop-up vaccine clinics. On Thursday, we have Mountain View Library and 49th State Brewery. On Friday, we have the Fifth Avenue Mall, the Red Apple on Mountain View, and the Anchorage Cider House. On Saturday, we have the Fifth Avenue Mall and the Anchorage Market. On Sunday, we have the 4th of July Parade, Fifth Avenue Mall, and the Anchorage Market. And on Tuesday, we have the Mountain View Boys and Girls Club, King Street, and the Loussac Library. Finally, just a reminder, we have mobile vaccine clinics that can come to you wherever you are, be it a church, business, or other organization. For more information or even to schedule, please dial 907-531-5100. Next slide, please. Next slide, please. With regards to public messaging from the Anchorage Health Department, as mentioned, our overall risk level is intermediate. This is evidenced by the increase in cases for the municipality to a rate of 5.04 cases for every 100,000 residents. That said, with approximately 55% of eligible residents ages 12 and over having completed a COVID-19 vaccination series, Anchorage comprises 2 subpopulations with very different COVID-19 risk profiles. Unvaccinated individuals currently experience a risk for COVID-19 infection equivalent to an average case count of approximately 6.9 per 100,000 residents, while their vaccinated counterparts experience a risk equivalent to 0.69 for every 100,000 residents. Also worth noting that while our current reproductive rate of 1.051 is a shift upwards from last week, our estimates may become more variable with cases only reported 3 days a week. And finally, we are continuing to watch the following community factors which may increase COVID-19 risk within the municipality. These include an increased prevalence of more transmissible variants of concern, a continued light demand for new vaccinations, a reduced use of non-pharmacologic interventions, including masks and social distancing, despite more than half of the total population still being unvaccinated. And finally, an increased number of travelers to Alaska for both employment and tourism. This concludes testing and vaccines. Barring any questions, end of report.
Thank you, Testing Vaccines. Mass Care, go ahead.
Happy Wednesday, everyone. This is Sean Hayes, Mass Care Branch Chief, reporting out. We have 4 discharges projected today from our quarantine and isolation unit, and 6 projected within the next week. Our numbers continue to decrease overall at the Sullivan Arena. We will see just a slight uptick at the end, as it is the end of the month, but we project a decrease with over the next week or so. And we are happy to say that we have 6 clients housed in the last week from our non-congregate shelters. End of report.
Thank you, Mass Care. Contract and Logistics, go ahead.
Hey, good morning. It's Scott Carpenter reporting out for OEM Logistics. You'll see a banner across the top, and just for clarification for everyone, as the emergency order ended on the 25th of May, procurement actions returned to the normal process in the municipality, which they are called Title VII procurement rules. So it just means that contracts cannot be established, or extensions can't be established in the manner in which we did it before under emergency conditions. Just simply means that there's much greater lead times. So we ask that everyone who needs assistance through us to please plan accordingly and expect longer than usual timelines to get contracts, new contracts and extensions through the purchasing office. For mass care support, we continue to wrap up the contracts that were either new or extensions that were approved by the Anchorage Assembly during their June 22nd meeting. This will continue to support the mass sheltering efforts through September 30th. For testing and vaccine support, the COVID testing contract bids are due back on the 7th of July, and that'll prevent any kind of gap in testing services to the municipality. The vaccination contract modifications have been implemented, and this will improve overall vaccination capabilities across the municipality. And in other support, we continue the ongoing staffing adjustments with new and extensions to meet the current COVID mission requirements. Pending any questions, end of report.
Thank you, Contract and Logistics. Finance, go ahead.
Good morning. Current encumbrances as of 6/30/2021 are $17,154,077. Actual spent to date is $64,368,627 for a total of $81,522,704. We are currently seeking cost recovery for expenses by way of federal funding, and that is currently underway. And we please continue submitting invoices and supporting documentation to EOC invoices at anchorageak.gov. End of report.
Thank you, Finance. Safety, go ahead.
Good morning. This is Annalisa Roberts reporting out for safety. We are quickly approaching a very wonderful holiday of July 4th, Independence Day. And with Independence Day comes barbecues, fireworks, parades, all of the good stuff. However, fireworks aren't safe, and in a lot of, in no part of the municipality of Anchorage, Girdwood, or Eagle River are fireworks legal. So leave it to the professionals to do that. But if you are going to a location that is legal to have fireworks, just follow some safety tips of never using fireworks while impaired with drugs or alcohol, never letting anyone using fireworks stand nearby, and if they are, they should be wearing eye protection. Never light them indoors, never let children light them off. Make sure you've got a clear surrounding before you do, and make sure you have a fire extinguisher and water nearby in case they don't light off. You can extinguish them before you start a fire, anything like that. So just use good safety measures from this slide. Also, maybe if possible, leave it to the professionals. Grab a blanket, grab the family, and go and watch them somewhere in Anchorage River, watching them be lit off, because it'll be a really great time. So enjoy and happy 4th of July. End report.
Thank you, Safety. Public information, you're next. Go ahead.
Hi, everybody. So we are continuing to peruse the local and national news for any COVID-19 stories that we need to share with our public and any emerging news to post, just to keep people informed of what's happening with COVID-19, both locally and nationally. We are always coordinating with our AHD counterparts regarding upcoming vaccination clinics. And we will be looking for some new ways to get the information out about all the different pop-up clinics, hoping to draw more people to those clinics and get more people vaccinated. And continuing to do outreach to the businesses so that they will host more of those pop-up clinics. And working with our finance counterparts on the United Way contract so that 211 can continue to serve as a call center for answering the public's questions about COVID-19, for instance, travel-related questions. They've been getting quite a few of those. And we will be working on 4th of July messaging, specifically around gatherings and how to get together with people safely, reminding people who are still unvaccinated that they should be wearing masks to protect others, and that even if you are vaccinated, with the prevalence of the new variants out there, and if you're going to be in a crowded indoor space, it's not a bad idea to still wear a mask. So some may still choose to do that even if they are vaccinated. And our outreach email continues to go out every day to let key influencers know where vaccination clinics are. And we're sad to say it is PIO Casey's last day with us. KL had led the public information team since January, and then passed that on to PIO Arono, but he has remained in a support position, and he's going to be greatly missed. And that's the end of my report.
All right, thank you, ma'am. Next up, liaison. Go ahead.
Good morning. This is Celeste Prescott. I'm reporting out as the liaison officer for the Anchorage EOC. Thank you to all of our partners that were able to join us today. Apologies for that. We'll go ahead and start off with Jenny from Salvation Army.
Good morning, Jenny Ragland with the Salvation Army. Just wanted to say thank you to the emergency operations team that has supported the cold weather shelter for families experiencing homelessness. The shelter discharged our last family this morning. And since April 2020, more than 260 families have received support through that program. So end of report. Thank you.
Thank you so much, Jenny. And do we have any other cooperators that'd like to report out at this time? All right, hearing none, we'll go right into our hospitals. And is Kirsten on for Alaska Native Medical Center?
Good morning. This is Kirsten at ANMC. Today, inpatient, we have 2 positives. One of those is in the ICU, not on a ventilator, and no PUIs. End of report.
Thank you so much. And I believe Sean is on for Alaska Regional Hospital.
6. Good morning. Alaska Regional Hospital has 6 COVID positive patients, 3 of whom are in the ICU and vented, and we have 1 PUI. Thank you.
Thank you so much for that. And is Nikki on for Providence Alaska Medical Center, or has Michael taken over now?
Nikki is here. Good morning. Today we have 6 COVID positive patients, 3 in the ICU, 3 on mechanical ventilation, and 2 COVID recovered. Thank you.
Thanks so much, Nikki. And Kara, are you on for Matsu Regional Hospital?
I am. Good morning, Care from Matsu Regional Medical Center. We currently have 1 positive that is in the ICU and on a vent. Thank you.
Thank you so much. And was Sergeant Perez or anyone else able to join us from the 673rd Medical Group? All right, unfortunately, doesn't sound like they were able to join us. And that's all for liaison. Thank you.
Thank you, ma'am.
It looks like we do have one question in the chat. It states the hospital dashboard is showing 39 available adult ICU beds in Anchorage. Is this correct?
That was the last place, but that was.
This is Jen. I just submitted that question because that's so much higher than we've had, any time since we've been tracking that.